This is the review from class, Chapter 8 from the Claywell book. Law mandates how we must behave toward each other. Ethics establish how we should behave. And ethics is a branch of philosophy. Nurses, lawyers, physicians, each have a code of ethics based on general ethical principles. Any ethical judgments require an assessment to assess the situation. Criminal law governs society to include common, statutory, and administrative. Common law is also known as case law, and it's a law that has arisen from judicial decisions, also known as judge-made decisions. Administrative law controls the administrative operations of government, but does not govern federal treaties or judicial misconduct. Statutory law is an enacted law. An example would be the Nurse Practice Act. Legal principles include confidentiality and the right to privacy. Health Insurance Portability and Accountability Act of 1996 is known as HIPAA. This is also known as Do Not Give Out Information, and failure to follow this act is civil and criminal penalties. Patient rights are the right to be treated with dignity and respect, privacy, decision-making, and confidentiality, access to health records, and the right to refuse treatment. Informed consent is a patient must fully understand what they are consenting to for the consent to be valid. Informed consent is grounded in the principle of autonomy. Two separate legal concepts with distinct elements is assault and battery. In short, an assault is an attempt or threat to injure another person, while a battery would be actually contacting another person in a harmful or offensive manner. This could also mean restraining a person who is alert and oriented or giving medication when they refuse. False imprisonment is verbally or physically forcing an individual to stay in a place against their wishes. Negligence is failure to use care as a reasonable, prudent, and careful person would use under similar circumstances. Professional negligence is also called medical malpractice or professional malpractice. Omission or commission of an act that departs from the standard of care, again, that a reasonably prudent person would do in the same or similar circumstance, is considered negligence. Accountability is a willingness to assume responsibility and then accept the consequences for your actions. Tort law is civil law. Legal wrong committed against a person or property, and intentional torts are assault and battery, false imprisonment, fraud, invasion of privacy, slander, and defamation. Unintentional torts are professional negligence. Malpractice is improper or unethical conduct or unreasonable lack of skill by a holder of a professional or official position. Medical malpractice is professional misconduct, failure to perform professional duties, and failure to meet the professional standards of care that result in harm to another person. Malpractice has 4 elements that must be present for a person to recover damages. The duty to care. This is the obligation exists to conform to a recognized standard of care. Breach of duty must be a failure to adhere to an obligation and a deviation from a recognized standard of care. Injury. Actual damages have occurred. Causation. The injury was foreseeable, caused by a breach of duty, and the conduct was the cause of the injury. Standards are used to prove malpractice, like facility policies and procedures, protocols, job descriptions, professional literature, expert opinions, State Nurse Practice Act, and the reasonable person standard. Following the above standards and using common sense can decrease the risk of a malpractice lawsuit. Accurate documentation will provide the best defense to a lawsuit. The guidelines to prevent negligence and malpractice is to perform only those skills that are within the scope of practice, staying current in the field of practice, delegating carefully and legally, administering drugs using the 6 rights, be aware of your own strengths and weaknesses, and advocate for your patient. High-risk areas are medication administration, and most errors are the wrong dose, wrong technique, wrong drug. High-risk areas include emergency departments, mental health settings, and specialty areas. The most common malpractice claims against nurses is failure to follow standards of care, failure to use equipment in a responsible manner, failure to communicate and document, failure to assess and monitor, and to act as a patient advocate. Failure to rescue is a lack of timely and appropriate response to changes in a patient's condition. Failure to recognize clinical deterioration, failure to communicate and escalate concerns, failure to physically assess the patient and treat appropriately, failure to prevent a clinical important deterioration such as a death or permanent disability. It's critical to monitor the patients carefully to identify any deteriorations and intervene. Documentation is required for accreditation and regulatory compliance to help make reimbursement determination and is examined by licensing boards for disciplinary action. Documentation errors are faulty record keeping, failure to include information, charting after the fact, misplacing records, and failure to follow standards of care when charting by exception. Mandatory reporting includes two specific types: child abuse and neglect, and elder abuse and neglect. There can be legal consequences for not reporting these types of situations. Nursing ethics. Ethics is a branch of philosophy that offers a way of examining moral life. It studies how we make decisions regarding right and wrong. Bioethics applies ethical theories and principles to moral issues and problems in the practice of medicine. Morals are what we believe to be right and wrong. It's often based on religious beliefs, culture, social influences, and life experiences. And a moral person is one who responds to a need and demonstrates care and responsibility in relationships. Values are enduring beliefs or ideals and largely shaped by one's culture. Then a person can have a values conflict. Moral development. This is how an individual learns to handle moral or ethical dilemmas. The universal principle of biomedical ethics begins with autonomy, the freedom to choose and make one's own decision, also known as self-determination. Beneficence is preventing harm or promoting and doing good. It's the most critical ethical principle in healthcare. Fidelity is practicing faithfully within the legal boundaries. It's keeping promises. Justice refers to fairness. Non-malfeasance is do no harm, and veracity is truth-telling. Ethical principles does mandate that cultural differences must be recognized and respected. A culturally competent nursing care entails integration of knowledge, attitudes, and skills of the cultural patterns of patients, families, and the communities they live in. The more insight the nurse has about their own values, attitude, and beliefs and practices, the more they are prepared. Cultural competence also extends to the workplace. Ethical dilemmas exist when a conflict arises among healthcare professionals, patients, families, and healthcare organizations. Moral courage is deciding on a right course of action regardless of the possible consequences. Moral distress is situations in which an individual knows the right action to take but feels powerless to take that action. Professional commitment is to follow the code of ethics for nurses. It provides a framework for ethical analysis and decision-making. It is non-negotiable and refers to patients' self-determination to make their own healthcare decisions. This is applicable to all practice settings and a variety of nursing roles. The Code of Ethics expresses ethical duties that are owed to the nurse, their patients, society, the employers, and their colleagues. So it's important to begin by gathering that relevant data. State what is the practical problem. Identify the ethical issues and the questions. Select the ethical principles and the theoretical frameworks to be considered. Conduct an analysis and prepare a justification, considering that there may be one or more counter-arguments. Explore the options for the action, and then select, complete, and evaluate the action. The Patient's Bill of Rights states that patients have the right to access their health records, the right to refuse treatment, the right to confidentiality, and the right to be informed about their medical condition. An alert, competent patient wants to leave the hospital, but the nurse thinks the patient should see the physician before leaving. The nurse restrains the patient to the bed. Which action did the nurse commit? The correct answer for this one is false imprisonment. False imprisonment is verbally or physically forcing an individual to stay in place against their wishes, and it is an intentional tort. Assault is a deliberate threat to physically harm another and is a crime, and a patient must fully understand what he or she has consented to for a consent to be valid, and the nurse did not perform an informed consent. And unintentional torts include professional negligence.